We are now going to discuss the different priorities that we should have as OTs in primary care, as well as different evidence-based programs. The identified priorities of OTs in primary care include effectively distributing important public health information to seniors and their families, increasing the use of clinical preventative services and health screenings, increasing participation in evidence-based health promotion and disease prevention programs, improving self-management skills and competencies, decreasing the number of falls and fall-related injuries, reducing food insecurity, and reducing isolation and depression. These are the initiatives of the National Council on Aging, focusing on increasing physical activity, management of chronic diseases, fall prevention, behavioral health, and self-management alliance. You can see there is an overlap between all these identified priorities. We should all be on the same page of what we should be focusing on with older adults through the primary care domain and lens. The Healthy People Objectives for Older Adults. The goal is to improve health, function, and quality of life. The areas of concern or focus include ensuring quality and availability of health services, clinical preventative services, ensuring providers are trained to care for older adults, and addressing health disparities for underserved populations and minorities. Proposed 2030 objective for older adults includes increasing the proportion of older adults with reduced physical or cognitive function who engage in light, moderate, or vigorous leisure time physical activities. Factors that influence health management and maintenance. The Healthy People 2020 objectives on older adults are designed to promote healthy outcomes for this population. Many factors affect the health, function, and quality of life for older adults. Individual behavioral determinants of health in older adults' behaviors include participation in physical activity, self-management of chronic diseases, or use of preventative health services, which can all improve health outcomes. Social environmental determinants of health in older adults. Housing and transportation services affect the availability and ability of older adults to access care. People from minority populations tend to be in poorer health and use healthcare less often than people from non-minority populations. Health service-related determinants of health in older adults. The quality of health and social services available to older adults and their caregivers affects their ability to manage chronic conditions and long-term care needs effectively. Examples of client-centered care for health management. They can use varied formats, including health education programs, self-management programs, client-centered OT programs, and performance skill training. The recommendations are for one-on-one encounters. Client-centered tailored programs have a greater impact than general education programs for older adults. Some examples of programs OTs have done include lifestyle redesign, bladder habit training, and cardiac rehab training programs. AJOT 2018 evidence showed that strong evidence supports the use of group, individual, or a combination of group and individual interventions to improve occupational performance. And group interventions were also effective at improving quality of life. So what can we do as OTs to address health management and maintenance for individuals with different chronic diseases? Consider the issues and concerns such as heart disease, asthma, COPD, arthritis, and diabetes. I'd like you to pause here and take a few minutes to think about this. What could we as OTs do to help individuals with these chronic conditions? Continue to think about this as we go through these modules. Evidence-based health promotion programs need to incorporate ongoing evaluation, increased awareness that will directly affect policy and program sustainability, and educating the public and policymakers on the impact that evidence-based health promotion programs have on participant health and healthcare utilization. This is the exact type of model that you'll be using for your programs that you're putting into place in the fall and you're drafting this semester in the summer. Evidence-based programs for older adults. The initiative to incorporate and utilize evidence-based programs for older adults, we need to consider, is this realistic? Who would be the target audience? What factors do we need to consider? And what kind of programs are already available? Promoting widespread use of evidence-based health promotion and self-management programs has been identified by the U.S. Department of Health and Human Services as a key strategy for improving care and reducing costs for people with multiple chronic conditions. Some more examples of programs. Physical activity programs, such as the Enhanced Fitness or Healthy Moves, which provide safe and effective low-impact aerobic exercise, strength training, and stretching. Fall prevention programs, such as A Matter of Balance, which addresses fear of falling, and Stepping On and Tai Chi, which build muscle strength and improve balance to prevent falls. And nutrition programs, such as Healthy Eating, which teach older adults the value of choosing and eating healthy foods and maintaining an active lifestyle. Additional programs include depression and/or substance abuse programs, such as Pearls, Healthy Ideas, and Beat the Blues, which teach older adults how to manage their mild to moderate depression. And the Stanford University Chronic Disease Self-Management Program, which are effective in helping people with chronic conditions change their behaviors, improve their health status, and reduce their use of hospital services. You could see more at the link below. Here are a few more links that I'd like you to explore. Please click on them and see what different programs are being offered to older adults.